My primary focus is attachment and trauma therapy. That emphasis really can carry over in a lot of things. How we attach to people and how we are able to relate to people focuses very heavily on a lot of things, but it stems from how were we raised? What did relationships look like when you were growing up? And all of these things, unfortunately, if you don't address some kind of disruption in attachment at any point, it can absolutely carry into adulthood. And then you start thinking about intimate relationships. So romantic relationships, sibling relationships, parent-child relationships, all of these can be affected and do affect how we attach to the world, how we relate to others. And trauma can disrupt a lot of that. You see somebody who's been in, even as adults, difficult relationships, or maybe an abusive marriage, something like that. It's 100% going to affect how they view the next relationship. Within that, there can be all sorts of other issues, a lot of post-traumatic stress. Maybe it doesn't go quite that far. Maybe there's just some anxiety. Maybe it's a learning to communicate, maybe in a more effective manner. When someone experiences a lot of trauma, their brain almost goes into what I would call survival mode. I'm just gonna do what I have to do to get through this day. I'm gonna do what I have to do this. I'm gonna have to do it. But once that stressor situation is gone, eliminated, changed, what have you, that survival mechanism may not be gone. And I think that people get stuck into these loops of I am the way that I am. There are absolutely things we can do. Being more aware of our surroundings, being more able to express our emotions in a positive manner. A lot of the ways that people learn to express themselves are from their parents or from, whoever their primary, example or caregiver was. So in theory, even if it's not happening now, if you brought your child in and you guys learned to talk together, I'm going to express my emotions this way, I'm going to express your emotions this way. In theory, that child, if done correctly, could grow up and maybe do a little bit better in their own life. It doesn't have to continue repeating, it doesn't have to be that cyclical. Over the years, I've heard things such as, I don't want my kid to be labeled. I don't want to slap this on them. I don't want to slap that on them. The issue with that is that it's just digging a hole. It's digging a hole that says the image and what I want it to look like or what I think it should look like is more important than help for my kid. The worst thing a parent can do is not be involved. Because the parent is the person that lives with this child. The parent is primarily responsible for caring for this child. They can help keep them on task. They can help them learn. Maybe they can lead a little bit by example, but ultimately you're your child's biggest advocate. You're your child's biggest support system. If they don't feel like that you are bought in, there's not going to be nearly as much work as I can do. Certainly they can sit and talk with me and maybe we can put some strategies in place, but a child really needs their parent to be the calm space, not someone who brings in more chaos. By and large, with mental health intervention of any sort, even if it's behavior changes, even if it's you're not going to bed on time, the earlier you jump in, the earlier you intervene, the easier it's going to be on everybody.